Hello, we are back with another week of our ACL Road to Recovery series. My name is James Young. I'm a physical therapist, athletic trainer, and part of the sports medicine team here at NovaCare in Philadelphia. Today we will be discussing the important role that hip and core strengthening plays in ACL rehab and why it is important in prevention of future injury. The majority of ACL injuries are non-contact injuries that occur while decelerating or changing directions. Studies have demonstrated that poor strength and control of your hip and trunk during athletic movements such as cutting, jumping, landing, and pivoting can increase risk for an ACL tear, as well as a re-tear following ACL reconstruction. Athletes who undergo ACL reconstruction are already at a higher risk for another tear, so it makes sense that strength and control of the hip and core are an important focus of the rehab process.
First, you cannot have control of these dynamic movements without developing adequate hip and core strength. Therefore, early in the rehab process, the athlete will be performing basic strengthening exercises to develop a foundation. We will begin with static and open chain exercises discussed in our previous videos, such as leg raises and clamshells. When appropriate, we progress to closed chain functional exercises such as planks, which can be a great progression from prone quad sets. Also, resisted sidestepping with the band, and lastly, balanced exercises that challenge the hip and core musculature. Studies have also shown that despite having adequate strength and good tolerance to functional activities, significant movement asymmetries with athletic activity may still be present. This asymmetry in movement can be typically seen as abnormal trunk sway, hip rotating in, and knee caving in. This has been referred to in the literature as dynamic knee valgus and has been linked to poor neuromuscular control of the hip and core. In other words, once we attain sufficient strength of the hip and core, we then need to train these muscles to function in good biomechanics in order to decrease the risk of re-injury. To do this, we will focus on exercises such as single leg step downs, overhead squatting, and eccentric single leg squats. This is also beneficial to provide external feedback during this phase with the use of bands, a mirror, as well as slow motion video to help with awareness and improve control of these movements. It is important to keep focus on this as we progress to the later stages of rehab that include plyometric and return to sport exercises. Thanks for tuning in, and please come back next week as we continue down our road to recovery.